Hello and welcome to the careers video on surgery. I will start by asking, who are you and what is your title?
Hello, hi, my name is Yesar Dhuwaib. I'm consultant general and laparoscopic colorectal surgeon. I also the surgical lead for medical student in the hospital, and I'm also the lead for pelvic floor service and the lead for transanal minimal invasive surgery in the trust.
Thank you. And how did you become a consultant surgeon?
Well, that goes back to when I was in medical school. When you're at that time, you start to think, first, do you want to be in a surgeon or you want to go into medicine or that specialty? So at that time, I used to go to theater and I was amazed how people come unwell and then they have the operation and they become better. So I start to think, surgery might be a good one. And then start working. I came to the UK. I did clinical attachment in Manchester Royal Infirmary with a consultant who was very interested in laparoscopic surgery. And I found that what I want to do. Laparoscopies were keyhole surgery, small holes in the patients, big job inside the tummy, quick recovery, and it's all with the high-end gadgets. So I thought that's what I want to do. And I started to go as a training in surgery. So we're doing at that time it used to be called basic surgical training. Now they call them core surgical training. And I did research as an MSc in surgical practice. And then I got my high surgical training in Yorkshire and worked in several hospitals, including York and Leeds. And at the same time, I was doing PhD part-time. So by the time I finished my training, finished my PhD, become consultant in Hastings.
Ooh, interesting. And what is it you do on your average day?
Well, the beauty about surgery, you don't get bored. Because some specialty, you do the same thing every day, every week. And today is like yesterday and yesterday like tomorrow. And general surgery it's full of excitement. So you have clinics. So I have 2 clinics, one in Hastings, one in Eastbourne. You have endoscopy. So that's where you go. Well, I do mine in Eastbourne Hospital, and you do 5 colonoscopy, and then you can look on the whole bowel from inside. And if there is any polyp, you can remove it at the same time. If there is any other pathology like cancer, we take biopsy, and that gives me more flavor. So I don't do the same thing. We have another day on Wednesday, I do my admin. So I check on the patient's results. If there is any query, check on my emails, make sure everything is fine. And every Thursday, I have a full day theater, and that starts at 8 o'clock till about 6. And this is very interesting, where we do our main role as a surgeon, and we help patients to resolve their current problem and recover quickly. And we have other days where we see the patients when they are in the ward, and we have multidisciplinary meeting for the bowel cancer, or because I do pelvic floor, we have every month one multidisciplinary meeting where we look on patients who have chronic constipation, or they have obstructive defecation, or they have fecal incontinence, or they have rectal prolapse. So you can see I have a very big variety of different things to do, and that will keep us enjoying the work. And every day is different from the day before. And this is our elective work. The other thing that we tend to do is our emergency work. And we do 1 week on call every 10 weeks. And that comes into 4 days and 3 days. So Monday to Friday, and another time we do Friday to Monday. And this is where we provide the emergency service to the whole of East Sussex patients. And the beauty about these days, you don't know what's coming. So you could be sitting doing nothing. You could be spending the whole day in operating theater to try to save people's life. And when you see the patients afterwards, particularly in clinic, they always thank you for saving their lives. And that's always the ultimate reward we get.
You've touched on so much you do there, but if I was asked to, if I was going to ask you if you had a most interesting day at work in the past, what would be your answer?
obviously we are surgeons, so the day that we enjoy it is when we are in theater. So that's where we operate. And what I like is what brought me to general surgery was the laparoscopic surgery. And that's why I enjoy the most. So most of my work tend to be keyhole surgery, where we do cancer surgery or advanced pelvic floor surgery, and most of them in keyhole surgery. I have to admit, I don't enjoy open surgery as much.
Thank you. And what advice would you give someone looking to get into gen surgery?
Two things. The first thing, they need to like it. There is lots of commitment and there is lots of sacrifice that we all have to do during our training. We live in, like when I was trained in Yorkshire, for example, I lived in Leeds, and then you have to travel to York or Doncaster or Huddersfield. So unless you try to move every year, but for me, I had a family, so that was difficult. Quite often we have day off, but we have an interesting operation, so we end up coming in our day off as pure out of our interest to build ourselves. So that comes with commitment. So first, people have to like what they want to do. And whenever you like something, you will flourish. If you don't like it, you will fail. That's in any specialty, any profession. So I think as a medical student, when they come to surgery, they should see how the acute surgical take works. They should see the elective side, and they should come to theatre. Because if they enjoy theatre, and I always advise them to come and scrub and assist. And the last two medical students, they were very keen, so they both end up scrubbed and assisting. So I end up letting the registrar operate. I stay in the back and let the medical student to hold the camera. So they have hands-on, and they both enjoyed it on that occasion. So I think that's very important. If they found that as something, that's what I want to do for the rest of my life, then they should go to surgery. Once they make that decision, obviously surgery is very competitive to get into as a training. So and I do interview for the core surgical training and high surgical training, which is national interview in London. It's highly competitive, so they have to do audits. They have to do where they close the loop. They have to try to involve themselves into research, getting a poster here, poster there, try to get their names on papers. They need to do some management. That's again comes as very important in the interview process, where they have to get themselves into certain type of management of their choice. Many people enjoy, I mean, the very common theme, they say, oh, I was a mess president. I was amazed how many mess presidents in the interview, but that's a very common management role. Another thing is teaching, and the teaching has to be designing something. So it's not like I do some word-based teaching. They have to be more structured program. And most people, once they do all these, they end up getting into the training, from my experience.
That's some excellent advice, I think. And for my final question, why should someone choose to work in gen surgery?
Why? They have to like it. It's highly demanding. I always say to people, you have to enjoy it. If you don't enjoy it, you will not succeed. You will not be a good surgeon. You have to enjoy it. So you spend your time learning and get trained, and you spend lots of time in simulation, trying to learn how to do the laparoscopy before they practice on patients. I think for me, variety, every day is different from the next day. And I like gadgets, and surgery is full of gadgets. Now there is robots, which we're trying to get, but we're still in the process of getting it. So it's something very interesting to me and most surgeon.
That's, I think, a good final answer there. As I said, that's all my questions. Thank you so much for answering them.
Okay, thank you very much, Alex. Bye-bye.
Bye.